As part of Premila's quest for determining how anatomy is used in practice, she's asked me, a physiotherapist who treats a lot of patients with low back pain. Traditionally, we strengthen the core musculature, which includes the transversus abdominis, which wraps around the front of the abdomen, multifidus, which runs across the back, the diaphragm at the bottom of the ribs, and the pelvic floor at the very bottom of the pelvis. With changes in research regarding low back pain patients, the field of pelvic health has grown and looks at the pelvic floor in a unique way.
So as a physiotherapist, I've been treating pelvic floor complaints for about 10 years. Pelvic floor complaints generally are often thought as stress incontinence or leakage, urge incontinence, or pelvic pain. Pelvic pain can be related to painful intercourse or just general pelvic pain. But as Kristen mentioned, we now know that the pelvic floor has a very close relationship to those people that have generalized low back pain. So if we look at the pelvic floor model, we can look at it from the front where we have our pubic bone at the front, our spine at the back. If I tilt it a little bit, you'll start to see the pelvic floor. This is a female model. So when we look at the first layer of the pelvic floor, that's the external tissue of the vagina. If I take that layer away, I'm going to be able to see the supportive nature of the pelvic floor. So Kristen talked about the layers of the other muscles, and I like to think of the pelvic floor as the bottom of the barrel. So at the front of the barrel we had transverse abdominis, at the back we had multifidus, at the top we had the diaphragm, and at the sides we had the ribs. But the pelvic floor is the bottom of that barrel. We have, in this case, a front pelvic floor muscle going from the pubic bone wrapping around the vagina opening. And then we have much bigger muscle at the back, which is our posterior pelvic floor muscle that's around the rectal opening. So when we want people to have a good lift of their pelvic floor, we're expecting that that bottom of the barrel is going to lift upwards into the pelvis to offer further support. And that's very important when we look at patients that have stress incontinence or prolapse complaints that are from weakness of the pelvic floor. But now we know with the low back pain patients that this contraction or the ability to lift that pelvic floor will also make that transverse abdominis contraction much stronger. And as a result, by assessing and treating weakness in the pelvic floor, we're actually able to help people with low back pain. So hopefully you can appreciate how anatomy is used outside of the school world. And we would encourage you to go to givingforlife.ca, and that will give you an opportunity to donate towards our cause. And at this time, we would like to nominate our colleagues at the Health and Performance Center so that they can show us how they put anatomy to work.